Okay, well, welcome to Cancer During a Global Pandemic. And with Jane Cargus, and I'm Brenda Helgett. Dr. Jane Cargus is a clinical psychologist who's been with Nebraska Cancer Specialists for 3 years. She earned her doctorate in clinical psychology, and Dr. Cargus works with cancer patients, helping them navigate the complex journey of a cancer diagnosis. I don't have nearly the great credentials that Jane has, but what I am is a cancer survivor. And I have been going through the pandemic along with all of you, and it has been eye-opening and frightening and required a whole lot of emotional support and just I almost want to say emotional interruptive feelings, because we're all frightened. If you went through chemo, I remember going through it. There wasn't a pandemic, right? And I remember being terrified to go to Walgreens and pick up my prescription. And I was so grateful it was winter, because then I could wear gloves and I could wear something around my face and not look crazy. But I was still terrified because I knew my counts were so low that a cold could kill me. And then here comes this pandemic. And then a whole lot of other vulnerable people were having these same feelings that we all had to live through, right? And as cancer survivors, we are still vulnerable. And even, I'm 5 years out now, but we still have to take care. So we're going to talk about that, and I'm going to give you the boring part, which is just kind of a little update about what's going on. And I don't want to say it's boring. I attended a really wonderful lecture, and it was with Otis Bradley. He is the Bloomberg Distinguished Professor, Department of Epidemiology at Johns Hopkins University. And this was just recently. This was just in the last month. And the bottom line is, he answered a lot of questions, but the bottom line is right here: we have to keep our guard up. We can't let it down. And this is because we have to take care of ourselves at this point, because other people are not going to do it. And this is the struggle we're having, isn't it? Is that it's become something that's political, rather than just wanting to help others. It's split up families. It's very difficult. And so we're here to help you navigate that a little bit, and we want to talk through it together, because we're all facing the same problems, and now it seems like another wave is maybe coming. And so we want to prepare you for that. So the biggest thing is wear your N95 or KN95 mask in public. And so, like this, right? So, but a few things I learned that I didn't know before. When you're wearing those masks, again, the goal now is for high-risk people to protect themselves, because others will no longer be wearing masks to protect the vulnerable. So these are made to protect you from other people. And the cloth ones, etc., just not the same. This is an interesting test. They said make sure it fits right, okay? This is the smell and taste test. You need to spray the front of your mask with perfume. If you can taste it, it's not fitting correctly. Yucky test, but there it is. And also, these need to be replaced daily. I am so guilty of using them over and over, and we really shouldn't be doing that. I mean, you can use it through the day, and then you need to toss it. Okay? So that was important. Men with full beards, they can't make these masks fit correctly. So if you have a loved one that's got a full beard, time to shave, honey. You're going to look 20 years younger. Promise. when we talk about high risk, I want to let you know that, we're talking about leukemia, lymphoma patients, especially B-cell malignancies, both active and in remission, are very, very high risk. Anyone treated with steroids or treatments that, decrease your white cell counts, even if fully vaccinated, you still need to take care. So I want to just let you know that. Of course, the whole 6 feet apart, no shaking hands, no hugging. I've been guilty of that today. Bump elbows, keep your hands clean. We tried to put hand sanitizer in everybody's bag, or for most people's, and we had it on the tables. Keep using it. I have it in my car, just a little pump thing. And boy, if I go to a drive-through or something like that and hand in my card, right, give it back, I'm sanitizing. I sanitize my card. Maybe, is that overkill? Maybe. But you know what? I haven't had COVID yet, not once. Whew. And I'd like to keep that record. So we talked about this just a moment ago. So high quality masks, etc. So local numbers in Nebraska, I have not updated this. I just looked at it just now. It's not a whole lot different, but I'm going to tell you this. We had, I think, 3 or 4 people cancel today because they were either positive themselves or their loved ones were positive. So I think that variant is coming back this way. So I think it's good that we're here talking about this, so we can better navigate those conversations. Just some numbers on vaccinations, who all is fully vaccinated and partially vaccinated. I'm on my 2nd booster. Talk to your oncologist, even if you're 5 years out. Dr. Ken Cowan is my oncologist. He is the director of the Fred and Pamela Buffett Cancer Center, top guy. He said, get the booster the minute it is available, and so I did. I know we all feel like pincushions at this point, but I think it's really important. Of course, healthy lifestyles help prevent illness. Stress runs down your immune system. Obesity, diabetes are big factors. I had a really good friend that had COVID just this last fall, and she had to sleep on her stomach just because the weight of her chest, she couldn't lift and couldn't breathe. It's a really something, folks, really something. And so that's something they do recommend. Another great reason to lose weight if you need to. Travel. Oh, I will tell you this. I went to Hawaii in January, and I got one of those. It looks almost like a double mask. Have you seen them? It's like this one, and then has a thing in the front. I think that absolutely saved me. I had that on the whole time I was in the plane, and I was just barely slipping food underneath a straw or something. But I really think those make a huge difference. I highly recommend them if you're going to be doing some travel. Planes, yes, they have excellent ventilation systems, but of course, taking your mask off to eat and drink increases your risk, so you have to be careful. Let's see. Let me keep going here. I am so sorry about the jackhammers going on, by the way. It's just been a day. It's just, all of you are so wonderful and patient. Thank you. Okay, treatment during a pandemic. Oh, I wanted to talk about evidence of antibodies because there's a lot of confusion about that. Just because, let's say you take an antibody test, right? That does not determine your immunity level. I'm going to say it again. It does not determine your immunity level. It just tells you that at some point you had it. That's it. These tests also can't determine immunity level from either vaccinations or naturally occurring infection. They can't tell the difference. There are some tests that can, but they're in test mode, if you will, at major universities, just a few across the country, that could tell the difference. You can have, this is so interesting, you can have antibodies for Delta, but not Omicron, and vice versa. I mean, it's really something. RNA viruses change frequently. 2/3 of the monoclonal antibodies that work for Delta did not work for Omicron. 2/3. And I know those antibodies were key in helping my friend. She was about to, they couldn't even put her in the hospital because they were full. And they told her to come in and get the infusion, and that turned her around. So obviously she had the Delta variant. So it's just another reason. They're working on it now, trying to get those antibodies for Omicron, but, you know, we just have to be careful. Hold on just a second. I'm going to talk, okay, and talking about variants. Do you remember when they were talking about the South African variant? Do you remember hearing about it in the news? What happened to it? Nothing. It fizzled out. Isn't that interesting? They don't know why. This is how this virus is. You just don't know. That's why with this new variant coming in, they just are keeping an eye on it. We all need to keep an eye on it and just keep watching. There are theories that they think that the new variants suppress or crowd out existing variants like Omicron did to Delta. Did you notice that too? It kind of put, Delta went away pretty much, and Omicron took over. So let's hope that the new variant that takes over is less devastating to us medically in terms of hospitalizations and deaths. Companies are working on vaccines specific to Omicron. You need to booster every 6 months for now. This doctor believes the virus will become endemic like influenza. We're going to get there. We've got to hang in there. We're going to get there. The biggest worry right now is children under age 5 are spreading the disease. I am a grandma, and I have 4 grandchildren. But I'll tell you what, I was with them on Easter. I had this on the whole time. And they get it. And I told them, I said, my little grandson says, Nana, why do you have your mask on again? And I said, well, honey, I'm going to have a conference, and there's going to be a lot of people there that I don't want them to get sick. He says, oh, okay. It's fine. Yeah. Oh, children are great, aren't they? It doesn't take much. This is the part I want to really talk to you about. Oops, sorry, clicked on the wrong thing. Oh, I think we're getting into your territory at this point. Sorry about that. But so I want to talk to you about how contagious were the different types of COVID. So this is fascinating to me. So they can actually measure the particles that were, what they did was they got a group of folks together, a big group of folks, and they measured particles that were injected into their nose, and they tested how many particles it took to result in at least a 50% chance of getting COVID, right? So how many particles did it take for at least a 50-50 chance of getting COVID? With Alpha, it took 10,000 particles, right? So you had to have 10,000 to have a 50% chance of getting COVID. Delta, it only took 1,000 particles. Omicron, it only took 100 particles. So Omicron was 100 times more infectious than the original COVID. So you can see how we have to be diligent going forward. And I believe this new variant is also extremely contagious as well. So, Jane, I apologize. I'm trying to remember where you're supposed to be. Yes, here we go. So Jane is going to come up here and talk a little bit about issues with family, friends, hard conversations, difficult conversations. We talked a little bit about this at holiday time, and we had such a great response. Please feel free to raise your hand, ask questions. Let's all share and help each other, okay? Thank you, Jane.
Yeah, thank you. Yeah, anybody have difficulties with family and friends around COVID? Oh, nobody. Okay, we're done.
Yes, it's a huge topic, and I know in our first session this morning, it came up about COVID isolation and just the incidence of depression and anxiety, and the question was, have we seen as the result of COVID a major increase in both? And the answer, of course, is yes. And part of this is it's a global pandemic, and we hear that term, but it just kind of goes in one ear and out the other. But what that means is there's just a collective all across the world, just this heaviness and this grief about all the changes. We talk a lot about grief when it comes to cancer and loss. There's so many losses that go along with the disease of cancer. But then, so we were suffering through that, and cancer patients were doing the best they could. Then we added COVID on to that. So it just felt like just this huge weight over something that was already very difficult to bear. So it's a collective kind of angst, a collective depression, anxiety. We don't know what to expect, and Brenda's talked about, what's coming. We don't know. So much confusion, and this Dr. Brawley that Brenda was referencing, he was very clear about the fact that science is such that we don't know. It is always, it's evolving, it's changing, and there were so many people, who were really against the vaccine, I think, to begin with, and then kind of took that and ran with it and made it more political than scientific. And science is that things are changing, and so you respond as best as you can to those changes. And so at any rate, it is COVID with all of the changes and with the isolation, and this is something that also came up this morning. The isolation itself, even, there was, of course, a fear of getting the disease and dying of the disease, but the isolation created by that, and you mentioned grandkids, just patients who have just been bereft about the loss of seeing their grandchildren, holding them, being with their families, their loved ones. And then another aspect of COVID, of course, is the division in families that occurred because of the pandemic and because of just the, kind of two different camps, the vaccine, anti-vaccine. And so, we've also seen just a huge rise in kind of the fracturing of families because of that. And so you add that on top of everything else. So people who now maybe aren't seeing family, not necessarily because of a fear of COVID, but because they're just in, they're so divided about the whole topic, and is it real? And so, but Dr. Brawley was very clear about, and I would really recommend you all listen to this. Is that in the notes, or we can give you the link? Mm-hmm. It's an excellent, it's just 60 minutes, but he's so knowledgeable. And he's like chief at Johns Hopkins. Yeah, really knowledgeable. But he is really adamant about maintaining distance and not being around unvaccinated people. And it's not a particularly popular topic, but, it's that those are his recommendations, that it's still too risky, and you have to keep your guard up. Those are the words he used. So continuing to mask and not being around people who are unvaccinated. So it's really tough, and I think all of us would like to believe that this is over or beginning to be over, but then, we don't know what's coming. So it's just really important for people to continue to be careful, and how you navigate that with cancer. I think, in my mind anyway, I think you just have to be your own best advocate, and you have to advocate for yourself and your health. And even if it's unpopular, which it will be, or if people scorn you or ridicule you for it, it's kind of like you just don't want to get COVID. And it's just too risky. So anyway, that was, what Dr. Brawley, I certainly don't know, but that's what he was saying about it. So, but just in terms of the isolation and the depression, one of the things I mentioned this morning was how telehealth just flourished in the midst of this pandemic. And, we had wanted to have it prior to that, clinicians did, but insurance companies were, no, and they control everything and call all the shots. And it's always so frustrating, but it's like, boom, suddenly. And Medicare, who are usually kind of lagging behind and things, man, they were on top of that and saying, yes, you can see people in their homes. And with Medicare, we can even just make a phone call. And I think that's because, obviously so many people on Medicare are older and might not have the technological skills. But it's been fabulous. And I have so many patients who are Medicare age they're great with technology. And once we get set up, it's really not that difficult. But they have kids or friends who help them sometimes. But that's really been a godsend. And we kind of, Kate and I and Lori have, been talking about, is it going to go away? Because there's always just this sort of overhanging threat that, insurance companies are going to pull that and they're not going to cover it and blah, blah, blah. So, we're kind of always a little bit vigilant about that. But we just sort of keep on top of it. And I think as long as the state of emergency that's still in effect. Is that a state-by-state thing? Because I think ours just got extended, didn't it? Kate, didn't it? Yeah. So that, I think as long as that's in place, we should be okay with telehealth. But a lot of clinicians and I think that telehealth is here to stay. So that's just a really good avenue for those who are so isolated. And if you aren't able to see your family and friends, seeing a therapist once a week, it's not a great substitute, but it's something. So, anybody have any questions or experiences? Yeah, Brenda.
Go back to something that someone else brought up, and I know I experienced myself. If you're, you said we need to advocate for ourselves, and that's hard to do sometimes when you feel like you're in the room is against you, right? I think is it helpful to try to find at least one person that might be on your side or sympathetic to and have a conversation with that person ahead of whatever family event you're trying to go to or whatever, to have a conversation with that person and say, hey, I'd really appreciate if you would back me up in this, and I don't want to get in a fight or anything, but it would just be nice to have someone else besides me say, you know what, she's a cancer survivor, she's more vulnerable, she really needs to be protected. Let's just, let her be. Just let her wear a mask, and we're so happy she's here. Mm-hmm. Is that helpful to find that ally?
Yes, to have an ally in this would be wonderful. Just somebody who you could sort of prepare with and who's going to be in your corner, because this is not going to win you a lot of popularity points, to continue to say, I have to wear a mask and I can't go here, and, worrying about unvaccinated people. People are just sick of it. And I see this all the time. And friends and friends' families, and, it's often become a source of scorn, really. But you have to stick with what you know, and if there's vulnerability with your diagnosis, then that's what you go with. And you just take the high road and explain that, I know it's old for me too, but I'm going to keep doing what I've been doing to protect myself from getting COVID.
Has anybody had somebody say, I know this sounds horribly rude, but has anybody had somebody say to you, why are you wearing that mask? It doesn't do anything. I see some heads nodding.
Really?
What do you say to somebody like that, Jane, that is saying that?
Take a hike.
To
Don't bother me anymore. I think, setting boundaries, that's obviously something as a therapist I'm always talking with patients about how to set and maintain good boundaries. And to me, it's a boundary issue. If someone is just kind of trampling on your boundaries and saying rude things, you just, in a neutral way, you just say, for me, this is my decision and this is what I'm doing. And, and just leave it at that. Keep it short, keep it simple. You don't have to explain, well, the CDC, don't even get into it. Just keep it short and simple and just for me. And, keep it personal to you.
Yeah, just say, it makes me feel better.
Mm-hmm. Mm-hmm.
You don't have to agree with it, right? You don't have to agree with
No.
It's what's best for me, and so.
Right. You don't have to agree. Right.
Just kind of
Yeah.
in what you've seen in your practice. I mean, we talked about like the post 9/11, where the country really came together and people were united. And it's this pandemic is just so distressing because it's such a world divided.
Mm-hmm.
I've never seen. I don't know that I've seen in my lifetime the world divided like this. But I don't know. I just want to get your thoughts on what you see in your practice and other events that have happened
Mm-hmm.
since you've been practicing. Does this seem to be the most divided that the world has been?
It certainly seems that way to me, yes. And in how people are responding to it and the depth of just despair over some of these family fractures that have happened.
Yeah, so close to home.
Right, because with 9/11, unless you were there or obviously knew people that were affected, we were very far away from that. But not so with this. This is in everybody's backyard and home. So, the divisiveness in the country, it's not something I've ever seen before. And it's very, very serious. Because I certainly don't see it getting a lot better quickly, So it would be nice if we could unite around this, but the polarized factions are just very strong around this
Yeah, just
on so many different levels.
institutions,
Yes,
fights over masks and things like that.
yes.
It's really been an eye-opening experience. And I'm like, am I being too doom and gloom about it? But it sounds like that's
I don't think so. And, this morning in the diversity, equity, and inclusion talk, it was just fabulous. And microaggressions and it just, I think everything seems to be so just bigger, in terms of people being very angry and very hostile. I guess that's what I see the most is it's a level of hostility that is incredibly high. So all the more reason, to practice meditation, just every single day, have some way of just calming yourself. And whether it has to do with cancer or what's happening in the world, Ukraine, that's another just heartbreaking situation. So the world is never, seems far from one disaster and traumatic experience after another, but the self-care involved in certainly, and I think that's what we're talking about with the mask, and that I will continue to wear this. I will continue to protect myself. And having some time every day where you have the ability to just sit and be quiet and still, and I use spirituality in my practice a lot, and I used to work a lot in California with people in recovery from addiction, and so the 12 steps, and which I think are just amazing for living for everybody, but just the one day at a time. And I will do, I have this 12 hours in front of me, and that's what I'm going to focus on. I'm going to focus on my health, and we all feel completely out of control, and there isn't a way to get control over all these extraneous things, but we can control what we do on a daily basis to just try to calm ourselves and to have a little peace in every day. I start every day with prayer and meditation, absolutely every day. And I tell my patients, just try this, like do it for 30 days. They talk about forming a habit, and if you do, it's something that you really miss, and because there's no TV, no phone, nothing for that first about half hour that I spend, and nothing gets in the way of that. And so I know with cancer and with caregiving and kids, and I don't have any of that in my life, and I'm fully aware of that. But just try to carve out 5 minutes. It doesn't have to be a really long time. But as Lori was talking about before, there's a physiological response to that, such that it just brings down the noise, because we have got to be quiet sometimes, and there is so much noise in the world, but that's the spiritual part of ourselves is what really responds to quiet and just being peaceful every day. And I think that's really where joy and hope come from as well. So yeah.
And I think it's important to use humor.
Yes.
I love using humor. I actually had someone say to me, I'm not even kidding about this, in a store. I think I was wearing the same pink mask. He says, why are you wearing that mask? I said, because I look fabulous in it. He just laughed, and I said, you know what? I said, I'm a cancer survivor, and I'll be darned if I'm going to let a virus take me out.
Good for
He
you.
said, totally disarmed him. And that's the other thing I was going to say
Yeah.
about the good side of being a cancer survivor is everyone understands that, right? Everyone knows somebody in their family that's had cancer, and a lot of times if you just say to them, hey, I'm a cancer survivor and I just want to protect myself, they usually kind of go, oh, okay. It's really disarming. Use humor, make it a joke, don't let it get to you. I agree with the breathing meditation. I don't watch the news. Sometimes you sometimes you just gotta shut it off, right? You just gotta shut it all off and be in your happy bubble, and find your tribe, find your allies. If you are coming to something like today, I bet you all came today thinking, this is my tribe. These are my allies. I know I'm going to be in a room full of people that are vaccinated, boosted, have been careful in crowds, right? It's awesome.
Yep.
And I'm glad we could provide that space for you. This is what you need to do more of. Find your tribe, find your allies, stick with them, use humor, use meditation. What else, Jane, can they do?
Well, just echoing that, your tribe, and kind of circling back to the recovery community, anybody who knows about that knows that someone who's in recovery, they have a tribe. They've got their 12-step meetings, and they've got the program, and they've got a higher power, and it is amazingly powerful in terms of, helping them stay sober and also just to live life. So, yes, I love that. And it really, again, is about finding, if it's one person or if it's, I was talking earlier about the online, just how that's just thriving now because of COVID. There really have been some good things that came out of COVID. So there are 12-step programs that are 24 hours a day. They're marathon meetings, and so people can just, plug in instantly. And I don't know of online meetings like that for cancer survivors, but there are some that, it's a matter of doing some research and trying to find, I mean, Facebook I'm sure has
Yeah.
groups, but I don't know,
Or you know what
that's
else
kind of hit and miss,
you
I
could
think.
do? If it's been a while since you took the time to heal, take it again. It's free. Find some new friends. Remember on the video today, Clarissa said, "Oh, I was sad when it was over," because she doesn't go out much, and she has transportation issues because of her eyesight and things, and that was her way of connecting with people. And if we can service that for you, great. We're going to start doing in-person classes again as well. But if that helps you connect with some new friends, we're here for that too. But yeah, Facebook has lots of cancer support groups. I know a lot of you probably took a time to heal thinking, I know when I first heard about, support groups, I don't know. We're all going to sit in a circle and look at each other and talk about our feelings. I don't know if I'm up for that. And then, of course, when you do it, you realize how special and amazing it is. And it's almost kind of like introduction to what the support group really is like. And you think, oh, this is great. These people understand.
Yeah, it's the camaraderie. And it's being with like-minded people.
Yes.
Because everybody who has cancer knows the really unintentionally insensitive things that people might say. I will say that kindly. Feels like people should just know better, but So, but that's really isolating too. And so it increases that sense of nobody gets this. And unless you've been through it, you kind of don't. So it is very important to have other survivors that you can talk with and have part of your tribe. And I think it just makes it easier then to bear the people that are disappointing you with what they're saying or doing or not saying or not doing. And people will often want to come in and say, "Oh yeah, my Aunt Betty had cancer," and her patient just So some things are just not particularly helpful, but people are they're wanting to help and they're wanting to kind of relate to you, but sometimes it kind of falls flat. So having other people who really get it is really empowering.
And don't do like I did and get obsessed with looking at COVID numbers every day either. Because that does get to you after a while as well. I think the basic message here is we've got to protect ourselves, right? No one else is really necessarily going to do that for us. Is that disappointing? Yes. Is it hurtful? Yes. But it is what it is, and I love my family. Thank God, I'm lucky. My family's very good about it. Except my son, he likes to tease me sometimes. He doesn't mean it, but he likes to tease me. He's like, "Really, Mom? Another matching mask?" But I just think we can only do for ourselves, and I love that Jane has so many good ideas about, just taking that quiet time, that me time. Again, if you just have the one friend that is supportive of you protecting yourself, go have lunch with that friend. Go sit outside and have a picnic. It's gonna be 84 tomorrow. That kind of thing. We can't change anybody's viewpoint or mine.
Right.
We just can't. But again, I think we can support each other as best we can. We're all gonna get through this. Thank God we have a vaccine. Thank God we have boosters. And they are, for the most part, doing their job. And like Jane said, we don't know what the future will bring, but we'll just keep plugging away together. Right? I want to hear from more of you, what you've been through. Do you have any experiences you want to share? I'm sorry.
Oh, it's okay.
You're in a safe space. It's okay. You can talk about Uncle Len that's a pain in your rear end.
I really dealt with a lot of skepticism about the vaccine, and even just on Easter, my niece, who's 18, right? She knows it all. I guess so with my husband, it was like getting the kids vaccinated. It was like, he disagreed and I agreed, right? So, okay, the younger ones, they're younger, but the older one, I'm gonna let her she decided she wanted to get it. So then my niece on Easter, she's like, "Oh my God, have you read what Pfizer just put out? You know Kylie's gonna die young, right?" I'm like, "No, Kylie's gonna live a great life and she's gonna have kids and we're not gonna worry about infertility." And it's like, you just have to ignore it and breathe, right? I'm like, "You're 18, honey." No. But skepticism has been hard.
Mhm,
And, you know, my
mhm.
house, luckily, we're not divided, like, we don't agree. But,
Well,
my husband, he's not, you know, it's just one of those things.
Right.
That's what it is.
And you just work around it.
We didn't let it ruin us, but it, you know, it's.
But I think that's such a good point. I'm a big believer in not arguing your points with everybody. I mean, if you have somebody that you really trust and you could actually have a good conversation, that's one thing. But just this needless, going round and round and I'm right and no, I'm right. And staying calm and neutral and maintaining boundaries to me is just, it's the best way to handle it. And a lot of people really do want to get worked up. I mean, I'm not on Facebook anymore, but I would be mystified by just some benign, like the sky is blue. Well, no, it's not, because, and there'd be a whole string of,
My absolute favorite saying is, he would argue that a sign was black when he painted it white himself. I know so many people like that.
I know. And we've just kind of turned into this culture of being argumentative, and I'm a right fighter, and I'm right about things, and I'm putting it out there. And I think social media, this is just my bias, but I think it's given a voice to people who are often voiceless, and it's now just a runaway train because people don't have discretion and they don't have restraint. And so I think that's one of the things we can do with this, is to maintain, just be reserved and calm and neutral and stick with the plan. This is my plan, this is what I'm doing, and not argue about it.
And this is in my
Well,
control. Yeah.
Right.
I admire you so much that you are married to someone, you're on absolute other side of the fence, but
Yeah, we're okay.
that's amazing.
Good for you.
Good for you, yeah.
You guys, what are hospitals doing now? Like, if you go to a hospital, like as a visitor, are you required to mask, or if you're a patient, or does anybody know what's going on right now in the hospitals?
Yeah, you have to mask.
And you get
Patients
screened
and
when you come in.
visitors, everybody.
Yes, you get screened.
And staff and everybody's
Take
all.
your temperature,
Mhm.
ask for
For
your
patients
symptoms.
in rooms, they don't have to mask necessarily.
Mhm.
But all the caregivers and all
Right.
visitors are masking.
Yeah.
If a patient is leaving their room, they mask them.
And that's throughout the city, I think.
Yeah. I think it's pretty standard.
Yeah.
Okay, thanks.
And you get checked when you come in,
Yes.
they check your temp and all that. But staff, like at the med center, you don't have to be checked as a staff member. You just have to show your
Oh.
badge and walk in with a mask.
Oh, okay, because I was gonna say, as a patient, I had to get checked.
Well, as a patient,
Yeah.
and as a guest, yes, but
Yeah,
as
as a guest.
As a
employee.
somebody working there,
Right.
you're
Yeah.
supposed to self-screen yourself.
Right.
Yes.
Check your symptoms in
You're
the
supposed to,
morning.
Hopefully.
if you have any symptoms, you should be coming.
Stay home, yeah.
Mhm. And then who knows what's going on with the airlines? I mean,
Didn't they take them away?
Mhm.
Yes.
Mhm. That's the latest.
it's.
Oh, I thought it was I thought it was already.
Somebody told me it got
Yeah.
delayed. That could be wrong.
Somebody put it in place, but then I think they they put a stop to that. So I think my understanding is it's not public transport.
You know, I know the planes, it was gone and no, and then some of the airlines said it's their choice, you know. I think a lot of the airlines were getting real tired of being physically assaulted over it, you know.
Oh, absolutely.
That flight attendants were so relieved that they didn't have to enforce it.
Yes,
Yeah.
yeah.
So how they took it.
Yes.
And Dr. Brawley made a really good point about the person who was interviewing him said, do you think, will the mask mandates come back? And he said, I don't think so. And it was just interesting when he said, and the reason being, everyone is totally sick of masks, but if we did that, it could prevent then people from taking action about something even worse than COVID, right? Do you remember when he said that? Yeah, and then because people are going to be so upset and mad about this that they're just going to just throw then all caution to the wind. And I don't know, where the CDC is concerned, I feel like that's kind of happening with some groups of people, but which is scary.
With the exception of that flu ride, it's been amazing how it's just kind of the norm now. Some people do, some people don't, and nobody really pays much attention anymore.
Mhm.
You know, like I said, I was surprised a stranger said that to me, but thank God I was ready for the comeback. But most people are just kind of like, you know, oh, you know, it's just normal. Kind of like, you know, remember for years we all used to be like, why are those people in Japan wearing masks?
Yes,
Now we're like,
always.
oh, okay.
Now we know.
I don't know about you, I have been really loving not having a cold or flu or anything. And I thought, gee, all I have to do is wear a mask and be a little bit better about washing my hands.
But it used to be like a freakish thing. I remember
Yeah.
being in church out in California, and there was one woman wearing a mask. This like 20 years ago, and it was like, you know, oh my goodness, like this must just be, you know, the bubonic plague or something. It was just horrible.
Yeah, what does she have? Oh my
What
God.
does she have? Yeah.
And now
So,
it's like,
yeah, and I'm sure she got a lot of grief. You know, I wasn't thinking that at the time, but yeah, thinking back on it. So, whether you're getting grief or not, you stick with what you need to do. That's what I say.
I hope you didn't come here thinking we're gonna have all the answers, because we don't, but I really do think, I know when Jane and I did this during the holidays, we had a gal that was very upset thinking about, you know, she wanted to go get on a plane and well, her family wanted her to get on a plane and go spend the holidays with family, right? And she was
Yeah.
very worried about it and concerned about it, and that was our advice to her was, you know, find a person in your family that will
Mhm.
be your ally and kind of take that burden off of you and take that kind of target off your back, and will stand up for you and just say, hey, this is what she's doing, just leave her alone,
Mm-hmm.
you know, and let's just be happy we're together.
Carry on.
Yeah, just carry on. And look at kids, they're so resilient. Just like I said, my grandkids, they just think Nana wears a mask sometimes. It's just
Yeah.
no big deal to them, you know, and I'm grateful, even the baby, he's 8 months old. He's just used to seeing it on my face. Kids
Yeah.
are just great that way. It's kind of funny how they can adapt so much better than adults.
I know.
You know, so does anybody else have anything to share or any questions?
Well, as a healthcare professional myself, and you know, thinking about you, Jane, and people in your position, your job, like you're tired of COVID yourself, and then you listen to it all day, and all these healthcare professionals are getting all of, you know, so much. The patient load is so much higher, and it's about the same topic over and over again. How do you deal with that? How do you want to stay doing this? Is there gonna be therapists down the road who are gonna help our kids with real problems and not COVID? You know, like, yeah, is there gonna be
Teachers and
anyone
students getting
that when we
Yeah.
really need to get back on track?
That's a huge question. I don't have the answer for that. Does anybody have?
Jane,
Holly, do you have?
you should speak on the trend of mental health, psychiatry, and counselors, of there not being any.
Oh, any available?
Yes,
Yeah.
skyrocketed.
Oh, it's amazing. Yeah, friends of mine that were always good referral sources, you know, for me. Nobody that I know is taking new patients. They're just full, and I have people that I know all over the country, and same thing. So, you know, people are definitely utilizing mental health resources, but it's just important to get help, and it really might take a long time to get in, but like for a healthcare worker, wow, and the burnout, I mean, I can't imagine what that's been like.
So be sure to use your EAP, Employee Assistance Program.
Yes.
And there are some
Yes.
online counseling resources that people are utilizing too.
Well, sure, telehealth, you know, and,
It also depends on what state you're in. I've had that issues with patients.
Oh, really?
That if the therapist is in another state and the patient's like in Nebraska or Iowa, sometimes the insurance will pay for it. So that's been a hassle
there,
for patients.
yeah, there's a whole licensing issue around telehealth, and prior to telehealth, it was that you had to be licensed in the state in which your patient was. So if they were on vacation in California, I had to be licensed in California to talk with them. And then with telehealth, that really eased up. And now there's something called SciPact, which is here, and a lot of therapists are getting licensed through that for like an area. And they're letting therapists do that, which is wonderful, because it really needs to happen. You don't want to start seeing somebody else if you move, you know, and that kind of thing. But yeah, looking online for resources, and Psychology Today is a really good resource for finding a therapist in Omaha and all over the country, really. So, and you can look at the person's bio and, you know, see the kinds of things they specialize in.
What about these things that, I listen to a lot of podcasts and they advertise BetterHelp is one, is this a subscription service, for, you know, so you can talk to, I assume, a psychologist, I don't even know. Is that something, if, you know, if there's just no other,
Yeah,
nobody's
and-
taking new patients, is that better than nothing? Maybe?
Perhaps. There's something called Doctor on Demand, too, and
Okay.
I know nothing about those
I've seen a
services.
commercial recently, something similar, that you can call and just talk to a therapist or a.
Right, well, Dr. Phil has everything, and he has something that, and he knows everything. But he has something that he promotes. So I don't know. I mean, obviously you'd want to check their credentials. You'd want to know they were licensed. And that's pretty hard to vet online. But I think, you know, if you find somebody on Psychology Today, you can always check them out. And it's a pain. But you can go onto the state's, you know, the licensing board in any given state and just make sure that person is in good standing.
I think especially if you're a healthcare worker, take advantage of your own people, you know, and you've got them there. And you should be demanding that you be able to act, I mean, you guys should be a first priority, really. If you can't take care of your own, you know.
Well, yeah, and that's the only place that I got in right away is our EAP program.
Yeah.
And that's the best therapist, because I tried several,
Oh,
you know,
okay.
I wanted to connect with a person. And
Yes, you do.
So,
Good.
I mean, it has been a really good resource and
Oh,
tool.
good.
Absolutely.
And there are actually a lot of local therapists who are only doing telehealth, too. Some of them have given up their offices, so, which is kind of surprising to me, given, I don't know, you know, we're not absolutely certain telehealth is here to stay. I think it is, but that was, you know, they've kind of gone out on a limb. So even if it's in town, you might not be seeing that person face to face either, which, you know, to me, we were home for, I think it was 2 months, Lori and I doing telehealth, and I was so glad to get back. I really was. It's fine. I mean, and it's great in, you know, when it's really necessary, but I like the face-to-face.
Especially with therapy.
Oh, yeah.
I mean, it's like talking over the phone. You don't always share everything over the phone because you're on the phone.
Mm-hmm.
Like, I'll tell you in
Mhm.
person.
Mm-hmm. Yeah. And thank goodness for the HIPAA compliant platforms that we have too. We use something called Spruce. And Zoom has a HIPAA compliant platform. You have to pay for it, but yeah. So that's good. Did that help at all?
Yeah, it's just
There's an overwhelming need in the healthcare community. So, and that's where I think, again, I'm not, saying I'm a huge proponent of telehealth, but for people who are working, 16 hours but just like to get an hour in without having to drive anywhere, it can really, really be beneficial just to kind of get the process going.